Part A. Extract 1. Questions 1 to 12. You hear a GP talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please, have a seat. So what brings you in today?
Good morning, doctor. Well, it's been a bit of a roller coaster lately, to be honest. It started subtly, maybe 6 or 7 months ago, with this persistent, almost gnawing epigastric discomfort. It's not acute pain, more of a chronic, low-grade ache, often exacerbated postprandially, particularly after what I would consider a substantial repast. Initially, I dismissed it as perhaps a transient bout of dyspepsia, attributing it to my sometimes irregular eating habits due to the exigencies of my demanding work schedule.
I understand. And has this epigastric discomfort been your only concern?
Not entirely. Concomitantly, I've noticed a rather unsettling pattern of, regurgitation. Not forceful emesis, mind you, but more of an effortless reflux, particularly after meals. It has this rather acrid taste, quite unpleasant. And lately, I've been experiencing these episodes of intense fatigue, almost a profound lassitude, which is quite atypical for me. I've always been rather energetic, quite active.
You mentioned your work schedule. Could you elaborate on that a little?
Certainly. I work as a software architect, which involves long hours, often sedentary, and quite a bit of stress to meet deadlines. I try to maintain a healthy lifestyle, I really do. I used to be quite diligent with my fitness regimen, regular yoga, brisk walking, but lately with this persistent fatigue, it's become increasingly challenging to adhere to that. My dietary habits, they're somewhat erratic. I often skip meals due to time constraints and then tend to overcompensate later, particularly in the evenings. I'm trying to be more mindful, but it's a struggle.
Have you tried any remedies for these symptoms, Mihiraa?
Yes, I have. Initially, for the epigastric discomfort, I tried over-the-counter antacids, which provided transient, albeit incomplete, relief. I also attempted some dietary modifications, avoiding spicy foods, reducing my caffeine intake, but the symptoms persisted. For the reflux, I even tried sleeping with my head slightly elevated, which seemed to offer minimal improvement. My mother suggested some herbal concoctions, a ginger and chamomile infusion, which I tried religiously for a while, but again, the relief was ephemeral.
Thank you for that detailed history, Mihiraa. Based on the constellation of symptoms you've described, the chronic epigastric discomfort, the effortless regurgitation, the fatigue, coupled with the information about your dietary habits and the lack of sustained relief from symptomatic treatments, I'm inclined to consider a diagnosis of bulimia nervosa.
Really? But I'm not overweight.
Mihiraa, this isn't solely defined by weight. It's characterized by a cycle of binge eating followed by compensatory behaviors aimed at preventing weight gain. These behaviors can include self-induced vomiting, misuse of laxatives or diuretics, fasting, or excessive exercise. The effortless regurgitation you described, along with the epigastric issues, can sometimes be a consequence of these behaviors, even if they aren't always overt or frequent. The electrolyte imbalances that can occur can also contribute to the profound fatigue you're experiencing.
All right.
The cornerstone of treatment is a multidisciplinary approach. This typically involves nutritional counseling to help establish regular and balanced eating patterns, psychotherapy, particularly cognitive behavioral therapy or interpersonal therapy, to address the underlying psychological factors contributing to the eating disorder, and sometimes pharmacotherapy to manage any co-occurring conditions like anxiety or depression.
So what's first, doctor?
We'll start by referring you to a specialized eating disorder clinic. They have a team of experienced professionals, including dietitians and therapists, who can conduct a thorough assessment and develop an individualized treatment plan for you. You'll also work closely with a dietitian to normalize your eating habits and address any nutritional deficiencies. We may also need to run some blood tests to check your electrolyte levels and overall health.
All right, I got it.
I'd like to schedule a follow-up appointment with you in 4 weeks. If you notice any deterioration in your symptoms, or if you have any concerns before then, please don't hesitate to contact the clinic or my office. It's important that we monitor your progress closely and adjust the treatment plan as needed. How does that sound to you, Mihiraa?
It sounds like a plan. Thank you, doctor. It's a lot to take in.
It's a significant step, Mihiraa, and you're not alone in this. We're here to support you.
Extract 2. Questions 13 to 24. You hear a dentist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. I'm Dr. Fisher Marvin. How can I help you today?
Good morning, doctor. I've been having this strange sensitivity in my teeth lately. It's been bothering me for a few weeks now, especially when I drink something hot or cold. I thought it was just temporary, but it doesn't seem to be going away.
I see. Can you describe this sensitivity in more detail?
It's more of a sharp, sudden pain, almost like a sting. It comes and goes, but it's worse when I have tea or anything acidic like citrus fruits. Sometimes, even brushing my teeth makes it worse.
That sounds uncomfortable. Have you noticed any changes in your teeth, like discoloration, or does your mouth feel different in any way?
Actually, yes. I feel like my teeth are a bit rougher than usual, and there's this weird transparency at the edges. It's quite worrying because I've never had issues like this before.
Alright, thank you for sharing that. Before we proceed, could you tell me a bit about your daily habits and diet?
I'm a tea checker and I usually taste around 15 to 20 cups a day. I also have a habit of drinking a lot of tea outside work. It's kind of my favorite drink.
Thank you for that information. Based on what you've told me, it sounds like you might be experiencing dental erosion. That's when the enamel on your teeth starts to wear away, often due to exposure to acids. Tea, especially if it's very hot or has a low pH, can contribute to this over time.
Oh no! Is it serious? What does that mean for my teeth?
It's something we can definitely manage, but it's important to address it before it progresses further. This weakens the enamel, which can lead to increased sensitivity and even cavities. Let me take a closer look to confirm the diagnosis. Alright, Mihiraa, I've just completed the examination. As I suspected, there's evidence of the condition on the surfaces of your teeth, particularly the front ones. I also noticed some wear on the molars, likely from the acidic exposure over time.
What can we do about it? Is it reversible?
Unfortunately, it isn't reversible because enamel doesn't regenerate. However, we can take steps to protect your teeth from further damage and manage the sensitivity.
What kind of steps?
First, I'll apply a fluoride varnish today to help strengthen your enamel. Over the next month, you'll need to use toothpaste specifically designed for sensitive teeth, which will help reduce discomfort and protect the exposed areas. I'll also prescribe a remineralizing gel that you can apply at night.
That sounds manageable. Will I need to make any changes to my routine?
Yes, there are a few lifestyle changes I'd recommend. Try to rinse your mouth with water immediately after tasting to neutralize the acid. You might also want to avoid brushing your teeth right after taking tea, as the enamel is softer and more prone to damage.
All right, doctor. Thank you for explaining everything.